Hi friends, myself Imran Khan. I'm a founder of Classia Health and I'm also a therapeutic and drug design scientist. So today, we'll talk about how are this Classia Institute of Metabolic Health, Classia Institute of Cancer Health, and Classia Institute of Cellular Programming, and Classia Longevity. These are the four specialties of our Classia Health. How all these four specialties are working.
Today, I'll explain the whole concept of metabolic therapy or metabolomics. This is the new and advanced therapy. There is a lot of work is happening on metabolic therapy. Through this, we can treat cancer and many other chronic disorders like diabetes, high BP, thyroid, obesity, fatty liver, PCOD, PCOS, fibroids, etc. So we found one root cause for majorly a four category of diseases that actually we are trying to address through Classia Health. The number one is lifestyle related metabolic disorders like blood pressure, diabetes, thyroid, obesity, fatty liver, PCOD, PCOS, etc. Second one is cancer related metabolic disorders. Third one is aging. And fourth one is cellular degeneration. And the root cause for all these four categories is gene expression and changes in gene expression due to metabolites. So gene expression are like roots and metabolites are nutrients. If we have healthy gene expressions and metabolites, we can have good health. If we have bad roots and metabolites, obviously we'll have bad health. Let's understand gene expression and metabolites more deeply. So this is how our body is made. So body is made up of organs are made up of tissues, and tissues are made up of cell. And each cell, cell is having two important parts, mitochondria and nucleus. Mitochondria is act like powerhouse or battery. In simple terms, just begin some example. If you compare cell with a smartphone, battery is like mitochondria and program of smartphone is like nucleus. Let's understand what is inside nucleus. So this nucleus is having 23 pairs of chromosomes. This blue colored one is the sac-like structure. This is called chromosomes, and each chromosome contains 46 DNAs. Each DNA includes 20,000 to 21,000 genes. These gene contains instructions for making proteins. Basically, these genes are having a programs. Genes are releasing millions of RNAs to produce proteins. Okay, and these proteins produces metabolites. So metabolites are like currency. Cell need currency to perform. Lack of currency leads to disease or death of cell. It is a simple example. Even if you need to travel somewhere, we have to give currency, right? To either cab or auto driver. Then only, he'll help us to drop somewhere. In the same way, if cell is having metabolites, then only cell will perform. If we don't have metabolites, our lack of metabolites leads to disease or death of a cell. One interesting point just I want to say, the length of all 46 chromosomes is 2 meters. It is almost 7 feet. Just imagine how God has embedded 7 feet worth of thread in an invisible cell. Now let's understand gene expression. So gene expression is at any given point, the information stored in gene to produce protein is called gene expression. And actually gene expression is changing continuously, often within seconds to minutes. Although the rate and extent depend on cell type and what the cell is experiencing. So there are many factors. Actually gene expression is dynamic. So the cell is constantly sensing the nutrients, like what we are taking or what food we are having, hormones, oxygen level, stress, inflammation, exercises, sleep or sleep pattern, drugs, toxins, temperature, infection, radiations. All these signals change the cell to turn thousands of genes on, off, up or down, and it leads to change in gene expression. So let's try to understand the concept of gene expression using orchestra. Just imagine, so in this image, just imagine this DNA is like a music book, and genes are like individual page of a book having songs. Gene expressions are like song script. RNA is like a music script sent to musician, okay? And these proteins are the musicians who are playing the music, and metabolites are the end music which is produced. So now if the script is wrong, if the script is some errors are there in the script, obviously wrong song will be played. Similarly, the body develops diseases if we have wrong gene expression. If we restore the script, right song will be played, the cell begin functioning normally again. So this is all about gene expression. Now let's understand metabolites. These metabolites, whatever the food we are eating, so first this food gets digested, and then these nutrients will be absorbed into blood after digestion, and these nutrients will be converted into metabolites through cellular metabolism. Okay, and here you can see number 6. These are the metabolites. These metabolites again it through DNA and through protein and all this through cell function, it converts to new metabolites. But these new metabolites are they are sending a signal again to DNA to produce a kind of what kind of new metabolites it has to produce. So we have published a book called Classia Theory of Metabolic Health. So we are claiming in this book, I have written this book and it is published and it is live in Amazon, and I am claiming in this book that cancer is not a genetic disorder, it is a metabolic disorder. So the disorder is happened because of this feedback loop. Factors like poor diet, sedentary lifestyle, stress, many chemicals, smoking, alcohol, some infections, viral infections, some drugs, all these creates abnormal metabolites and hormonal changes, and these abnormal metabolites causes inflammation and oxidative stress, and these abnormal metabolites, as we discussed earlier, it alter the gene expression, and these altered gene expression, it leads to formation of again a protein, it changes in the protein, and it leads to it damages the DNA. Okay, so again this damage in DNA, because DNA is having a program, DNA is having information, right? The information, it also having information related to when to stop the growth of cells, so when to control the growth of cells, so that will become abnormal, that information, that code will get corrupted, and it starts thereby the uncontrolled growth of abnormal cell will start happening, and that leads to development of cancer. Regarding treating cancer is concerned, along with gene expression and metabolites, we also need to understand how cancer is metabolizing, how it is developing new cancer cell, and how and what is the energy source, whether it's glucose, glutamine, or fat driven, or all three of them. A treatment for cancer is based on two principles. The first one is preventing the growth, starving the existing cancer cell by blocking the energy source of cancer cell. And second one is preventing recurrent cancers by changing the gene expressions. Friends, here whatever the stage, whether it's a third stage, fourth stage, until unless the organ is not damaged, so we can stop the cancer in any part of the body. We can stop the cancer. As soon as cancer starts serving, the symptoms start diminishing, and revival of health will happen. Okay, so to understand the cancer's metabolic signature, we need to understand the cancer's metabolic signature. We will do many advanced tests here, such as NGS, that is next generation sequencing, transcriptomics, etc. So based on these results, we will recommend again diet changes and supplement and nutraceuticals and some off-label medicines like high-dose vitamin C, and we'll also use our own compounded medicines. So here, regarding cancer, we have two type of services in Classia Institute of Cancer Health. First one is Classia Metabolic Cancer Therapy. It is for those who have not yet started the treatment. So it includes again the diet changes, supplements and off-label medicines as well as some compounded medicines. And regarding one more program we have for those people already who have undergone chemo and some sort of radiation therapy, surgery, all those things. So to prevent recurrence, further recurrence, we have something like Classia Metabolic Cancer Prevention. So here we recommend diet changes, supplements and nutraceuticals and some off-label medicines. And friends, as you all aware, more than 90 to 95% of the cancer patients are stable patients. And so to run our program, we are managing this program in daycare facility. So in this picture you can see how poor diet, excess calories or sedentary lifestyle, stress, environmental chemicals, creates abnormal metabolites in our body, and that leads to inflammation and oxidative stress. That is called altered gene expression, okay, and that leads to insulin resistance and high blood pressure. In the same way, in this slide you can see how these external factors are changes the metabolites, and that leads to a genetic expression, okay, change in genetic expression, and it causes change in protein and enzymes. That leads to blood vessel dysfunction, kidney dysfunction, hormonal imbalance, and that leads to high blood pressure. Okay, and in the same way here you can able to see this again, these external factors, how it causes change in metabolites, and that is releasing more amount of free fatty acids, ceramides, diacyl glycerols and reactive oxygen species, inflammatory metabolites, and that leads to altered gene expression, and that decreases the fat burning, mitochondrial function, and increases the fat storage, appetite signaling changes, insulin resistance, and that leads to obesity. In the same way here, poor diet, obesity, stress, and genetic susceptibility, all environmental factors, all this again changes the abnormal metabolites. It leads to insulin resistance, okay, increase in insulin resistance, increase in oxidative stress and inflammatory metabolites. It changes the gene expression, and again it leads to androgen production, more androgen production, and less ovulation leads to hormonal imbalance, and it causes diseases like PCOD or PCOS. Okay, and in the same way here again this poor diet, obesity, stress, hormonal factors, and genetic susceptibility, all these things, it leads to abnormal metabolites. Again, it causes oxidative stress, inflammation, and insulin resistance. It alters the gene expression, and it leads to increase in cell proliferation, collagen production, and decreases the normal cell death, and it causes fibroid formations. Again, a high calorie diet, sugar, alcohol, obesity, and insulin resistance leads to abnormal metabolites, and it causes increased triglycerides, ceramides, and the glycerols, and reactive oxygen species, and this causes inflammation and oxidative stress. It leads to again change in gene expression, and it increases the fat production and decreases the fat burning, mitochondrial function. It leads to fat accumulation in liver cells and cause fatty liver. We are treating lifestyle related metabolic disorders by identifying your gene expression and metabolic health through various blood tests and urine analysis. And as per the result, we recommend basically diet changes as well as supplements and nutraceuticals. Our treatment is showing excellent result. Only in just 3 days, we are reversing the symptoms of major 3 disorders like diabetes, high BP, and obesity. Other disorders like thyroid, fatty liver, PCOD, PCOS, and fibroids, these are all related to hormonal changes as well. So it will be reversed in 1 month. And around 100% of our patients are enjoying a drug-free life, and they're living happily without taking any medicines. And we are also working on Classia longevity. Classia longevity is again it's related to aging. Aging will happen due to change in again gene expression. So as the genetic gene expression changes, it start displaying in terms of our aging. So by reversing gene expression, we can reverse the age also. Here, not only reversing the gene expression, we also need to work on mitochondria. So we need to work on mitochondrial health. So around 37, close to 37 trillion human cells we have in our body. So just imagine for each cell on an average some 20 odd we can add as a mitochondria. So close to, just imagine how many mitochondria we have in our human body, close to some 600, 700, more than those many trillions mitochondria we have in our body. So their health also plays very important role, because as age progresses, particularly this mitochondrial health will get affected. So in longevity, we need to take care of mitochondrial health to reverse the aging and gene expression. Friends, we also have something in longevity. We also have something like a health risk detector. It's a AI based tech. So what we do, we identify the health risk related to heart and cancer, liver, well in advance, like 6 months to 1 year advance. Just imagine if we come to know like somebody is getting heart attack 6 months early, so we can save his life. So in cancer, if we come to know well in advanced stage, we can save their life. So we have that kind of program also. And one more specialty regarding Classia Health cellular programming, it's about regenerative medicine. This specialty we are not yet launched, but we are working on this project. Again, we are developing a wonderful drug. So this one drug, one injection can completely change the gene expression. And the beauty is it can convert the damaged or diseased cell to stem cell. So once this drug is ready, we can recover the damaged eye, damaged liver, kidney, and cartilage for osteoarthritis kind of problem. I hope you guys have understood what is Classia and what kind of specialties we are working on, how it works and everything. So those who are interested in any of our services, please call back. Thank you so much.